Bryan,
How are you?
nice to see you again.
Good.
How are you?
Good.
Oh, thanks for doing this.
4 years ago, when I made Inside Child Poverty, Dr Bryan Betty at Porirua told me about the totally preventable diseases that he was seeing on a daily basis.
I suppose a lot of what we see acutely are things like skin infections, chest infections, upper respiratory tract infections, ears, nose, mouth.
What about other diseases, like rheumatic fever?
We see a lot of rheumatic fever in this area. For example, in the last 3 weeks, we've had 2 acute cases of rheumatic fever at the surgery, which have been confirmed.
I wanted to know if he'd seen any changes in the last 4 years.
Certainly the problem's not resolved, but there's been steps in the right direction. A couple of examples. One of the big initiatives is now free healthcare for children under the age of 13, which has just been introduced. I think that's made a big difference in terms of access to healthcare.
You've still got to bring your kids to you, though, don't you? They've still got to come to the centre. You saw the documentary in the Swedish system where the doctors go to the schools. What do you think about that?
Okay, well, the big initiative that's now been run out, and again, this is the other change, is probably the throat swabbing in schools. So kids with sore throats, and this is the rheumatic fever issue, there's now a big program with public health where nurses are going into schools a couple of times a week, that's primary schools around the area, and swabbing and treating all the kids with sore throats. Now that's had a real profound follow-on effect in terms of highlighting the issue with sore throats and rheumatic fever.
I suggested to him that while these were all positive changes, the real problem was not being addressed: cold, damp housing.
Yeah, I agree with you. There are problems with the housing stock. Now, significantly, it's not just the houses themselves, it's often the size of the houses. So if you get a family, like a Pacific family, with lots of children and mum and dad, and you've got standard 3-bedroom houses, there's not enough room for the whole family. So we're actually starting to establish links with things like Housing New Zealand, the charitable organisations, to go into families of high needs with housing problems and kids that need, and sort of do some interventions.